Fellow Guyanese, I am Dr. Karen Gordon-Boyle, Deputy Chief Medical Officer, and I am here with you today to provide the COVID-19 update for May 13th, 2020. An update of the global COVID-19 situation is as follows. According to the World Health Organization's report dated 12th of May 2020, there are 4,088,848 confirmed cases globally, with 283,153 deaths. In the Americas, the number of cases is 1,743,717, with 104,549 deaths. Our statistics for today are as follows. We have tested 34 persons within the last 24 hours, and of those tested, we have no new cases. The number of positive cases remains at 113, and the number of COVID deaths remains at 10. Recovered cases are now 41. In total, we have tested 1,020 persons, with 907 being negative. We currently have 5 persons in institutional quarantine and 62 in institutional isolation. Our COVID-19 ICU has 3 persons. As of yesterday, we now have confirmed cases in 7 of our 10 administrative regions. This is the situation that we were trying to avoid when we instituted the guidelines, with a clear understanding that limiting the spread of this disease to as few regions as possible would have guaranteed us a quicker resolution. With this new development, our only hope is that you, our citizens, finally realize that unless you act responsibly, our health system is at risk of becoming overburdened with COVID-19 cases. The lessons learned from many countries that have managed to slow the rate of infection and contain this disease were either by forceful measures or by the disciplined participation of their citizens to join forces with the government. Those citizens would have stayed at home when they were advised to, maintained the physical distancing in public spaces, washed their hands before eating, touching their face, and before engaging in activities with others, cleaned the surfaces in their homes and places of work as often as possible, reached out for medical attention when unwell or if they were knowingly in contact with a positive case. I can assure you that though these guidelines may seem simple and imposing, they worked. On the other hand, what you saw as a reality in the United States of America, Italy, China, and Brazil may become the new reality for us. Of importance to note is that our neighbor, Brazil, continues to have an increase in cases as well as deaths. Please note, over 800 deaths in 24 hours. This increases the risk for Guyana because of the constant unofficial cross-border travel. My dear residents of Region 9, I hope that you are taking note, that you have a very important part to play in protecting the communities bordering Brazil. You can limit the risk of exposure of your communities by 1, adhering to the guidelines, 2, immediately raising the alarm by notifying the authorities as soon as illegal migrants enter your community. The question you must now ask yourselves are, will you continue to doubt that COVID-19 is a killer? Will you continue to act as per normal because it's not in your community? Or will you finally get your act together? The answer to all these questions remains in your hands. What have we at the Ministry of Public Health done to facilitate our general public? There are mobile units, especially in the epicenter of this pandemic, that are visiting various communities. We need you to access these units. We continue to provide updated information through daily briefings and our communications campaign that is countrywide. We have an app for you to report to, as well as the hotlines. Please do your part. This battle is not lost. My fellow countrymen, but we will only win if we work together as a team. United we stand, divided we fall. Let's beat COVID-19. Please stay safe, Guyana. Good afternoon, and thank you.